Hello friends, let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Lesson 73, cysticercosis, tapeworm in the body, muscle layer, not in the brain, not neurocysticercosis. Let's go. Once upon a time in the Florida state, there was a newspaper manuscript telling us doctor shares the horrifying scan of the patient's legs filled with parasites after they ate the undercooked pork. An emergency room physician shared the CAT scan of a patient diagnosed with a parasitic infection called the cysticercosis. The newspaper named people. How horrifying! How horrifying the grain-like calcifications in the upper legs. The parasite's name is, academically, Taenia solium. We just call it tapeworm because it looks like tape. This picture is from the Wikipedia, cysticercosis. Left one is invaginated head, scolex. Right side one is invaginated head, scolex. Usual shape of the cysticercosis. It's a larva with scolex and cyst. Tissue infection caused by young form of the pork tapeworm. People may have few or no symptoms for years. In some cases, particularly in the Asia, solid lumps of 1 to 2 centimeters may develop under the skin. After months or years, these lumps can be painful, swollen, and then resorb. A specific form, the neurocysticercosis, which affects the brain, can cause neurologic symptoms. This is the cysticercosis. These are the symptoms and signs of the cysticercosis. Number 1, muscles. Cysticercosis can develop in any voluntary muscles. Usually it is asymptomatic since cysticercosis die and calcified. Number 2, skin. Subcutaneous cysts are firm, mobile, occurring mainly on the trunk and the extremities, sometimes get painful. 3. Central nervous system. Neurocysticercosis is generally accepted to refer to the cyst in the brain parenchyma, which causes seizures and other symptoms. 4. Eyes. In the eyeball, extraocular muscle and under the conjunctiva, they live. The imaging findings of the cysticercosis. Number 1. In the active phase, radiograph rarely shows anything. Nothing can be shown. Number 2. Calcified cysts, that's what we see, are apparent on the radiographs. 3. Millet seed-shaped elliptical calcification in the muscle. The same ones are looking like rice grain calcifications. And 4. Altogether, they look like starry sky appearance, just like the painting of the Van Gogh. As we all know, left ones are rice grains and the right side ones are millet seeds. The cysticercosis, calcified cysticercosis are looking like these grains, seeds. This is the life cycle. Let's begin from the 3 o'clock. Man eats infected pork, pig muscle, and then the infected feces from the man is eaten by the pig or cows on the 9 o'clock side. And cysticercosis gets into the muscle of the pig, pork, and we also repeatedly eat the pork of the infected one. That is the vicious cycle between pig and the human. subscribed and said good to me. Dankeschön, thank you very much. Let's enjoy the first chest radiograph of the cysticercosis patient. On the chest radiograph, many grain, millet seed-like calcifications are scattered in both axilla, neck, chest wall. Let's look at in the enlarged, magnified, square yellow images. Just like as rice grain calcifications, aren't they? We see 5 axial and coronal CT images of the same patients of a previous chest PA. We see many millet seed, rice grain calcifications in the skeletal muscles. Many number of calcifications are scattered all through the skeletal muscles. And his abdominal CT images show us many other calcified cysticercosis in the abdominal skeletal muscles. How about rice grain calcifications in the simple abdomen, neck AP, low ankle AP images? They are all in the skeletal voluntary muscles. These are another patient's chest radiograph and simple abdomen images. We see many taenia solium calcifications, cysticercosis, calcified cysticerci in the voluntary muscles scattered all over the body. This is also another patient's CT scan. Now you are also familiar with the calcified cysticerci in the skeletal voluntary muscles. These axial CAT scans are of the abdomen CT of the same patients. We see many rice grain calcifications. How do you feel now? Horrified, surprised, or feel some interest? His brain CT also shows the calcified neurocysticerci in the brain tissue, so-called neurocysticercosis. We also see the hydrocephalus. Do you like this painting with the name The Starry Night by Vincent van Gogh, 1889? How wonderful this picture is. I feel great with these paintings, but some doctors imagine these stars as the calcified cysticerci in the muscles, regrettably. Differential diagnosis? Actually, I don't think it necessary to differentiate bullet, calcified granulomas, gold tooth crown, acupuncture, gold. Do you think differential diagnosis is necessary? If you have any plan to voyage to the parasitic republic, undercooked yummy pork? Oh no, don't even think about it. Undercooked, don't even think about it. It's over now. How do you feel now? Was it interesting? Thank you very much. Thank you for watching. If your son quit smoking, wonderful, bravo!